Hello, everyone. It's Dr. Cary Yurkiw. Welcome to today's webinar on colic. It's a webinar that one of my patients requested because she said, when her children were young, she took one of her children to the chiropractor because her child had colic and it really helped. And she said, it'd be great if you could do a webinar on colic. And I was thinking back to over the years in my career of different times parents brought their children in for colic. I have my own children. I have two children, and at times they were colicky. And um, I'm going to talk about that today just so you can learn a little bit more about colic and how chiropractic can help. So thanks for joining me today on Instagram Live and here on YouTube Live. So what is colic? Well, it's a fussing or a crying that really doesn't go away. So you comfort the baby, you feed the baby's in a comforting environment, and they continue to cry for no apparent reason. So that is hard on parents, and I know because I've been there and done that, and I know how hard that is on especially new parents that really want to make sure their baby's okay and their baby's being well taken care of. So it's frustrating when you're doing everything you can and your baby is still really fussy and crying. You don't know what the cause of it is. Sometimes you notice bodily tension too. So parents will say, when I touch a certain spot, the baby cries more, or it seems like it's coming from this region. So um, when a parent brings a child into the clinic and they say that, we want to check that area. Babies do have a spine, has more cartilage than an adult spine, but they do have a spine that has nerves running through it, the spinal cord and nerve roots, and they do have joints in their body. And sometimes the nerves do get pinched, or there's muscles that are tight in the body. And the way that babies communicate that is by crying. And you or I, we'd say we're in pain, or we'd kind of like be holding a certain area. But for babies, they're just crying uncontrollably, and that's their way of communicating. So when I've seen children in the clinic with colic, and it's a chiropractic issue, I found that touching a certain spot can make them arch their back more or really react to that area. And that's kind of the area we want to focus on. So as a chiropractor, we're going to check for any misalignments. And sometimes misalignments are there because of um, the birth process. So the twisting and pulling at birth. Sometimes babies, just the way they sleep or move or the way they're placed, maybe in their carrier, they can get misalignments too. So we want to check them for misalignments, and we'll do it similar to this picture here where they're just on their stomach, or sometimes they're lying on their mom or dad in the clinic, and their mom or dad is face up and the baby's on their stomach, and we're able to check their spine. We check for muscle tone, see if there's any irregularity. So if there's tension in certain areas, we want to note that, and then we want to gently improve on that condition. So gently do adjustments. Sometimes we'll do it just like this with our thumbs or our pinkies. Sometimes we'll actually pick the baby up and gently massage and adjust them using our thumbs. So adjustments for the baby is quite gentle, and of course it's the right amount of force. It's scaled according to the baby versus a teenager or an adult. So and what I found is in some situations it can be very helpful right from one adjustment. So sometimes one adjustment is just brings so much relief. Other times it takes some follow-up, but when we do the adjustments, the baby can relax, they can rest. Often parents will come back and say, my baby slept really well, or my baby had a bowel movement, that kind of thing, because they were able to relax. And so it can be very helpful, especially when you've tried a lot of things, and you're just not sure what's causing the colic. So this is an area I think where chiropractors are very specialized, is checking the spine, checking the muscle tone, and checking to see if there's something wrong that could be causing the baby to be uncomfortable. If you're interested in bringing your child to the clinic, we are seeing new patients in the clinic, and you just have to scan this QR code, or you can click on this link right here in our show notes, and that'll take you to the scheduling screen. A menu will pop up, and you'll be able to click on the top item, which is schedule an initial appointment. I'd be happy to see your baby and see if there's any connection to colic from their spine or their muscular system or the joints in the body. If you're not in our area, I'd be happy to consult with you and to help you find somebody who's qualified in your area. I took 2 years of extra training in pediatrics, and required going down to Miami on a monthly basis, which I really enjoyed. I enjoyed learning. I enjoyed the environment there, meeting other chiropractors that were studying pediatrics. So I really enjoyed studying babies and prenatal care and different conditions that children have and how we can help. And I started going to see a chiropractor as a child, and that made a huge difference for me, and it was more of a knee issue. So really that's the origin of why I became a chiropractor, was some knee issues that a chiropractor was able to help me with. Also, follow us on social media. We're at Dr. Cary Yurkiw. That's our handle on Instagram, Facebook, and Twitter. Subscribe to our YouTube channel right here, and then you're going to get updates when we do go live. So you'll be updated when we're on YouTube Live. Sometimes we upload videos. You'll get updated when the videos are uploaded. And then our podcast is called Super Healthy. So go on Apple or Android, and you'll be able to subscribe to our Super Healthy podcast, and you're going to get the audio version of these webinars that we do. Thanks so much for joining me today. Hope you learned something about colic, and if there's anybody that needs help, certainly you can pass on the message and let them know about us.